Institute of Unani Medicine, Bengaluru. Dr. Iftikhar Hussain Ghazi, Medical Superintendent, Kashmir Tibiya College Hospital and Research Center, Jammu and Kashmir. Dr. Rohit Kumar, Assistant Professor, Department of Pulmonary Critical Care and Sleep Medicine, Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi. All participating registered delegates, I welcome you all to day 3 of the webinar series organized by CCRUM. Friends, we all know that Ministry of Ayush, along with its research councils and national institutes, has taken noteworthy steps in combating the difficult time of COVID-19 pandemic. This webinar series organized by CCRUM is also an extension of IC activities of Ministry of Ayush to create awareness and provide scientific platforms for deliberations on various aspects of the COVID-19 pandemic. And yes, since past 2 days, we have had fruitful deliberations on the lessons learned and role of nutrition in maintaining health from eminent speakers. We got a good feedback from our participants. We thank them for joining us. So here we are on day 3 of the webinar series on management of COVID-19 cases, experience sharing. And to inaugurate today's webinar, we have the Director General CCRUM, Professor Asim Ali Khan sir, with us. In fact, I must mention that under the dynamic leadership of Professor Khan, all officers in the headquarters and its 22 peripheral institutes worked dedicatedly during COVID-19 pandemic as per the mandate of Ministry of Ayush, and CCRUM took many initiatives which I will request sir to highlight. Before inviting him to those new participants who have joined us today, I will inform that sir is the Director General of CCRUM, a leading institution of scientific research in various fundamental and applied aspects of Unani medicine in the country. He is holding the charge of Advisor Unani in Ministry of Ayush and is also the member of Board of Governors, National Commission of Indian Medicine, Government of India. Sir is directing and coordinating various research and academic activities of CCRUM and collaborative research programs with leading academic scientific institutions of the national and international importance through its 22 peripheral institutes spread across India. He is involved and responsible for planning, implementation, governance of quality education, training and researches in Ayush system through all Ayush universities, all India institutes, national institutes, research institutes, government and private colleges. He has brought out many publications in Journal of Repute. And he is also member on various important committees of Government of India. So I take this opportunity to say that sir has taken many new initiatives and taking the work of CCRUM to a new direction, and under his leadership, I'm sure that CCRUM will be treading towards greater heights. With this, I invite sir for his inaugural address. Please, sir.
Thank you so much, Dr. Ghazala, for introducing. Assalamu alaikum and a very good afternoon to all. My colleague, Professor Abdul Wadood Sahib, the Director, National Institute of Unani Medicine, Bengaluru. Dr. Iftikhar Hussain Ghazi Sahib, the Medical Superintendent, Kashmir Tibiya College Hospital Research Center, Jammu and Kashmir. Dr. Rohit Kumar Sahib, Assistant Professor, Department of Pulmonary Critical Care and Sleep Medicine, Vardhaman Mahavir Medical College, Safdarjung Hospital, New Delhi. All participating delegates, my colleagues from the council who are coordinating this activity, ladies and gentlemen. I welcome you all to the third day of this webinar series on COVID-19 pandemic. Experiences and lessons learned being organized by CCRUM, Ministry of Ayush. In fact, this is a series of the dates 15th of December to 21st December 2021. We have already done 2 days of very informative lectures on lessons learned during COVID-19 pandemic and role of nutrition in maintaining health. These two and very learned professors from different spheres of life and different fields of expertise were there. And I'm sure that the insights and experiences shared by those esteemed experts have deepened our knowledge and understanding of the unprecedented challenges faced during the pandemic and how the available infrastructure was to be optimally utilized to combat the COVID-19 pandemic. The proactive initiatives taken in a timely manner by the Ministry of Health as well as Ministry of Ayush, Government of India, had contributed significantly in control and management of the pandemic. The contributions of the Ayush systems in maintaining health and improving immunity have been outlined by the speakers in the webinar. As far as today's webinar is concerned, the theme for today's webinar is Management of COVID-19 Cases, Experience Sharing. Friends, in the wake of the unprecedented public health emergencies created by this COVID-19 pandemic, several initiatives were taken to integrate traditional interventions along with standard medical care for effective management of this infection. While the strengths of the modern medicine were utilized in providing the symptomatic treatment and critical care to COVID-19 patients, the strengths of Ayush systems were also utilized for strengthening the immunity and providing effective prophylaxis in the management of COVID-19. CCRUM, under the guidance of Ministry of Ayush, also undertook various activities and measures to check the spread of pandemic by creating awareness, advising preventive measures, and providing prophylactic medicines. The multifaceted approach of Unani interventions significantly contributed in improving the immunity in these difficult times of the pandemic last 2 years. CCRUM carried out several COVID-related research projects, initiating clinical studies on different Unani regimens. A population-based prospective study on effectiveness and outcome of Unani intervention on the population at risk of COVID-19, prophylactic in COVID-19. Another study was interventions of Unani medicine on high or moderate risk population of COVID-19. Add-on study entitled Prospective Interventional Case Control Study to observe and assess the safety and efficacy of Unani regimen in preventing the progression of the severity of the disease in hospitalized SARS-CoV-2 tested positive asymptomatic COVID-19 cases, managed as COVID-19 management guidelines. That was also carried out.
I think there's some network issue.
Rollback. Further, I studied to assess the safety and efficacy of add-on Unani regimen in prevention of the severe RT-PCR done in collaboration with Safdarjung Hospital in New Delhi. The efficacy of 4 Unani formulations against SARS-CoV-19 virus was also established through in silico studies in one of our institutions, that is Regional Research Institute Unani Medicine Chennai, in collaboration with one university there. 21 papers on COVID-19 were published by CCRM related to COVID clinical and other R&D initiatives and were uploaded in the National Repository on Ayush COVID-19. I would also like to mention here that CCRM had distributed Ayush 64 to more than 7,000 people through the 16 peripheral centers. And you already know is a scientific based adjunct to standard care in the management. 64 as asymptomatic, mild and moderate COVID-19 and is advised to improve the clinical recovery and the quality of life of such patients. Under the Azadi Ka Amrit Mahotsav, the 75 years of our independence, the Unani prophylactic medicine Khamira Marwari was also distributed to huge number of population through 20 centers of our council, and Unani guidelines for diet and lifestyle have also been distributed among the masses. Not taking much time, because I know experts also have to have their busy schedule and there is a time specific for them. I will not take much time, and I would like to conclude by saying that these proactive initiatives, the collaborations between organizations, the scientific research and active participation have contributed tremendously in effectively meeting the challenges posed by this pandemic. Our esteemed speakers for today will be sharing their experiences in the management of COVID-19 cases. I once again welcome our esteemed speakers, Dr. Iftikhar Hussain Ghazi, who is the Medical Superintendent Kashmir, the College, Hospital and Research Center, and Dr. Rohit Kumar, the Assistant Professor, Department of Pulmonary, Clinical Care and Sleep Medicine from Safdarjung Hospital and Vardhman Mahavir Medical College. I also welcome my colleague, Professor Abdul Wadood, who is the Director of National Institution of Unani Medicine in Bangalore, who will be moderating this session. And I'm very confident that the deliberations and experience sharing will be of immense benefit and value for the participant who will carry forward those understanding once they will take it from our leading experts today, and they will be using that in our day-to-day life and their practices by the practitioners who are participating in this webinar today. Thank you very much. Jai Hind.
Thank you. Thank you, sir, for giving us an insight in the various activities in which officers of CCRUM are engaged. And we thank you for blessing this program. Now we begin with our webinar on management of COVID-19 cases, experience sharing. And I invite Professor Abdul Wadood, sir, the Director at National Institute of Unani Medicine, an academician by profession with special interest in medicinal plants. He has more than 2 decades teaching experience and is having more than 70 research publications in national and international research journals. And he has guided 33 postgraduates for their MD dissertation. He is also supervising 2 PhD scholars. He is editor-in-chief of 2 peer-reviewed research journals. He is the co-author of 8 books and has translated 4 Unani medical manuscripts from Persian to English. And he has been bestowed with Best Teacher Award and many other awards. And he has got fair knowledge of Urdu, Hindi, English, Persian, and Arabic languages. So we welcome you, sir, to moderate this session. And I will invite our first speaker, Dr. Rohit Kumar, who has done MD in medicine from VMMC and Safdarjung Hospital and DM in pulmonary critical care and sleep medicine from All India Institute of Medical Sciences, New Delhi. He is the member of the Royal College of Physicians, UK. He is currently working in VMMC and Safdarjung Hospital as an assistant professor. He has also received a Commonwealth Scholarship and various other fellowships. He has multiple publications to his credit and has been an invited faculty to various national and international conferences. So I invite Dr. Rohit Kumar for his talk.
Good evening, everyone, and thank you for this warm invitation. It's great to be here with all of you. So I'm going to be talking about the management of COVID-19 cases, how our experience, and this is a new thing. We've just learned about this 2 years ago. So now we gradually, teaching each other about how to go about treating such cases. So I'll be talking about the experience gathered over these last 2 years. So let's talk about a case. This is something all of us must have seen, somebody must have discussed at one point or the other. So you have a 65-year-old diabetic man who presents with a history of contact with a COVID positive case. He has fever, malaise, sore throat. And this is how it started. If you remember the year 2000, the beginning of 2020, we were talking about contact tracing. We were looking at cases and we were seeing a few mild cases at that point in time. So this is a patient who has a normal saturation, normal respiratory rate, X-ray is normal, but his RT-PCR is positive. So what do you think we do about this case? Well, as I said, we had this definition of a suspect case. Then we had what is a severe acute respiratory infection, a probable case, but now we've got a confirmed case, a person who is RT-PCR positive, confirmed, no doubt that this patient has COVID. But how do we go about treating them? This is the question that we're going to be addressing today. So just a very small slide. I'm not going to spend too much time here, but to realize it's not very easy to treat them, because we were thinking you can give an antiviral or you can bring the inflammation down. It sounds very counterintuitive. You want the body to fight this infection, but we were treating these patients with steroids. It sounds very counterintuitive that patients were given antiviral drugs, they were given immunoglobulins to neutralize the virus, and still it was not working. So that's when we went to the pathophysiology of it. So there's a phase in which there's the viral response phase. This is the initial part. Here the virus is replicating. So if you're going to give anything that can, fight the virus at this stage, it's going to be really well. Then after a while, the host inflammatory response comes in, and this will try to reduce and neutralize the virus. However, there are a few patients who have a very strong inflammatory response, and when they have a very strong inflammatory response, it causes what is known as the hyperinflammation phase. You must have heard about it, the cytokine storm that was talked about. Now this cytokine, they are in such large numbers, they start damaging the tissue. So at this stage, we want to actually bring the immunity down. So you have to see in what stage your patient is. What would be the ideal drug for which stage of the patient is. This is something we learned as we went along with it. So I've seen so many patients who are in the viral response phase where we want the immunity to fight this virus. The virus is replicating, we want the immunity to fight the virus. We want a strong immunity, and this is where people were giving steroids. So the problem was, you can't just give steroids to anybody. You have to give it to a very selected cohort of patients. You want a strong immunity, but you don't want it, such a strong immunity that it starts affecting the body. So we wanted a balance. And this is what, this is a sum up of what we've learned in these last 2 years. Moving on. Now we got this 35-year-old diabetic man. No doubt, COVID confirmed. This is not even a probable case, suspect case. It is a confirmed case. But will this patient progress is a question. And this is, again, we got data on this. Patients who are elderly, patients who have diseases, heart diseases, hypertension, coronary artery disease, diabetes, lung diseases, kidney diseases, liver diseases, all these patients are at risk of progression. So they may start as a mild disease, but they can progress to a severe disease. Our gentleman, the case that we're talking about, a 35-year-old diabetic man. So I have to be really careful. This fellow can progress. However, all said and done, he is still a mild case. I said the saturation is normal. I said the pulse rate is normal. I said the respiratory rate is normal. The X-ray is normal. What this tells us is that the virus is probably only in the upper respiratory tract. It is an uncomplicated upper respiratory tract infection, has mild symptoms, without shortness of breath, without hypoxia. Now, if the patient has facilities, he needs to be home. He can be given home isolation or be sent to a COVID care center. Mind you, home isolation does not mean that the patient is fine. The patient has symptoms. He needs to be treated. And we have to monitor so that this patient should not progress. We have a diabetic patient with us. So what do we do in home isolation? We've talked about hydration. We've talked about multivitamins, having a strong immunity, antitussive, which is just reduce the cough, antipyretic, to reduce the fever. Now, if you look at the guidelines, these were taken this from the Ministry of Health and Family Welfare guidelines. At one point of time, there was a lot of talk about ivermectin. There was a lot of talk about HCQ. These two drugs are not really that great, if you ask me. This is again experience sharing. So this is what we've learned over the last few months and probably the last 1 year. One drug that does really work is inhalational budesonide. I'll come to this in the later slides. So this is how I will be talking about. We have a meta-analysis which sort of looked at all the drugs and looked at what is good and what is bad in a manner of speaking. And let's see, what do we have here? So ivermectin, a very common drug that we already talked about, was used a lot at one point of time. Well, look at the mortality. We are not certain whether it works. This is in this diagram, you can see usual care and ivermectin. You can look at the grade of evidence on the far right, and let's look at mortality. Uncertain whether it works. Whether mechanical ventilation, uncertain whether it works. Viral clearance on day 7, not much difference. Hospital admissions, higher degree of uncertainty. Now look at adverse events, and I know this is not adverse events, these are serious adverse events. There were 27 per thousand in the ivermectin group, 9 per thousand in the usual care group, which means it actually favors using usual care rather than using ivermectin. And time to clinical improvement was pretty much the same, just about a half a day difference. So it's not an important difference. So, ivermectin came and now it's gone, to put it in the simplest of terms. Now, what about HCQ? Hydroxychloroquine, I'm sure you already read a lot about it. So same outcomes of mortality, mechanical ventilation, viral clearance, admission to hospital. Look at the the evidence. First of all, it does not reduce mortality. It probably does not reduce mechanical ventilation. Is its effect on viral clearance very uncertain. The effect of HCQ on admission to hospital uncertain. And this is not a study of just about 100 people, 200 people. This is a large amount of data that's been gleaned and looked at, and based on this, we're coming up with these. We're finding that these drugs, although they were thought to be very effective, were not really that effective. Then I'm sure all of you must have heard of this favipiravir. At one point of time, it was almost impossible to get it from the market. Everybody was buying it. When you look at the evidence on it, let's go by evidence. The mortality rate in the favipiravir group was approximately 30% less than the control group, but this finding is not statistically significant. This was a very small study, and favipiravir exerted no significant beneficial effects on in terms of mortality in the general population. So if you look at it, going back again, we wanted to see whether you're giving it late or we're giving it early. Most of the studies don't favor its use. Even early studies, late studies, day 14, day 7, no favipiravir actually scores better. So if you look at this, this is another forest plot. If you look at this diamond, it is in favor of not giving favipiravir. Right? Another drug that was talked about was Fluoxamine. Now this was used. We in India haven't used it that much, but in the US it was used among ambulatory patients with COVID-19. The Infectious Disease Society of America guideline panel recommended use only in the context of clinical trials. They were not very sure it works. There is, if you look at this, forest plot, diamond is in favor of fluoxamine, but it is touching 1. This essentially means that we are not very sure whether it works, but there's a trend that it favors fluoxamine. That means it may be beneficial, but we don't use it that much. Now coming to inhalational budesonide, I'm a pulmonologist, so my experience with inhaled therapy is good. One thing that I like about inhaled therapy is it does not cause too many side effects. The reason being, when I take a puff, the drug goes into my respiratory system. It does not go into my systemic circulation. It does not affect my heart. It does not affect my brain. It does not affect my body, my bones. It does not affect my stomach lining. None of those side effects. So inhaled therapy is very safe. And then we had this brilliant trial which was published in the New England Journal of Medicine, where they said that early administration of inhaled budesonide reduced the likelihood of needing urgent medical care, reduced the time to recovery after early COVID-19. So we're talking of a mild case, but here also, as I said, I want to prevent the progression of disease. I want this person to have a good immunity. I want this person to fight the virus. Inhalation budesonide worked very well. Now, another thing that was, let me just go back, sorry. So another thing that was there was, you all must have heard about it. It was the monoclonal antibody cocktails. So there are 2 monoclonal antibodies which neutralize the virus. And again, let's look at the data for non-severe. Non-severe means that these patients were, they were easily manageable probably. So probably the viremia phase was going on. In that, we give this antibodies and we neutralize the virus. So you can look at the mortality, not much difference. Mechanical ventilation, no important difference. But look at the hospital admission. We're talking of mild patients. If we do not give them this, it is 42 per 1,000. But if we give them this, it is 13 per 1,000. So we can prevent, by giving it to 1,000 patients, we can prevent almost 29 getting admitted. Now, it's expensive, no doubt about it, but it works. With regards to allergic reactions and adverse events, there was no important difference, and time to symptom improvement was also better. So from 14 days, it came down to almost 9.9 days. That's also a good amount. So it's expensive, no doubt, but it works. It reduces admissions. It reduces the time to symptom improvement. And what about severe cases? Now I was talking about patients, who are mild, but who are at risk, like this 35-year-old diabetic patient that we began with. So probably if I'm worried that this fellow is going to progress to a severe disease, I can use these antibodies. Let's look at what about if patients are severe. Here also, it actually reduces the mortality in severe disease. it reduces the mortality in critical disease, and it reduces the requirement for mechanical ventilation. And these are quite significant. You know, we treat 1,000 patients. In 42, we can prevent the need for mechanical ventilation. There will be fewer cases of mortality, 69 per 1,000 cases and 39 per 1,000 cases. So it's good. And here the evidence is also, you know, kind of strong, moderate amount of evidence. So this was one case. You know, we talked about mild treatment, how we go about it, how some drugs were tried but did not do well. Some are, you know, working well. Some are preventing progression. So let's talk about another, you know, the similar case. Last time he was mild, the saturation was okay, his respiratory rate was okay, and the X-ray was okay. But what if this gentleman had a saturation of 91? What if his respiratory rate was above 24? What if the X-ray showed in opacities? Still a case of COVID, but now it becomes moderate COVID as per the Ministry of Health and Family Welfare guidelines. So there is pneumonia. It's not severe, but there's definitely pneumonia. The patient's oxygen is starting to fall down. The respiratory rate is going up. Such patients cannot be left at home. Such patients cannot be kept at a COVID care center also. They need a center which has hospitals, which has oxygen, and probably if such patients deteriorate, they may have to be shifted to an ICU. So we want a dedicated COVID health center for such patients. Now, what do we treat them with? Well, obviously, oxygen is low. We give them oxygen. Now, this is where we believe, you know, this patient's inflammation is going out of control. This inflammation, the cytokine storm, is going to cause damage to this patient's lung. So we use anti-inflammatory or immunomodulatory therapy. I'll talk about this in a little more detail, but steroids. And that's one important lesson that we learned. Steroids save lives. Then, probably you've all heard about this. Many patients had what is known as clotting problems. There were clots being formed in the blood vessels, and they used to cause death. So it's just a personal experience. My neighbor, who was, you know, diagnosed with COVID, had been discharged from a hospital, and 2-3 days later, he died at home. He did not die because of a lung disease. He died because of a heart disease. And we now believe that it was because he had a clot. So now we're giving patients anticoagulation, which is kind of a blood thinner. Then there are certain off-label uses of remdesivir and tocilizumab. I'll come to that. This is as per the emerging WHO guidelines. Another important lesson that we learned about COVID, and it's really nice, because earlier we used to do proning in ARDS patients. Patients who were on the ventilator, we used to sedate them, paralyze them, and prone them. And it was observed that doing this improves their oxygenation. Now in COVID, we started taking these patients who had hypoxia, and we used to prone them, which means they lie on their stomach. And with this, their saturation used to pick up. The requirement for oxygen, say a patient was on 5 liters, he could be oxygenated even with 1 to 2 liters. So when the oxygen crisis was hitting us, we wanted to reduce the oxygen consumption, it helped. We had patients who could not get oxygen, even then it helped. So awake proning was a very important lesson that we learned. And now let's come to steroids. You know, this is one thing that steroids work. So when you look at mortality, when we look at the use of mechanical ventilation, non-invasive or invasive, they were specifically invasive in this question, there was, if you give it to 1,000 patients, 30 less will require invasive mechanical ventilation. If we give it to 1,000 patients, we could be saved 34 people who would have died otherwise. Now, when we give steroids, you know, we always worry, will it cause gastric bleeding? Will it cause super infections? Now, we've got anecdotal reports of patients having fungal infections because too high doses of steroids were used. But in trials where steroids at right dose at the right time was used, the risk of bleeding, the risk of super infections were less. Yes, the sugar goes up. There is a risk, the electrolyte balance goes, you know, haywire, but at the end, it saves life. And this was also a meta-analysis. You know, you've probably heard about the Codex study, the recovery study. Now they've used different steroids, dexamethasone, hydrocortisone, methylprednisolone. But if you look at it, all of the studies more or less favor the use of steroids. Now, all of them, in fact, if you club all this data together, it means that steroids work really well. So it favors the use of steroids, and in all moderate to severe patients, we do recommend the use of steroids. So prospective meta-analysis of clinical trials of critically ill patients with COVID-19, administration of systemic corticosteroids. This is not just inhalation, Now the patient is severe, we give systemic corticosteroids. Compared with the usual care of placebo, it was associated with lower 28-day all-cause mortality. And again, anticoagulation, this was another important lesson. So in non-critically ill patients with COVID-19, an initial strategy of therapeutic dose anticoagulation with heparin increased the probability of survival to hospital discharge with reduced use of cardiovascular and respiratory organ support. So this was another important lesson that we learned in the last 2 years. We used to, in our ICU, we give stress DVT prophylaxis to all our patients who are bedridden. But here we started giving it to non-critically ill patients also. Critically ill patients in the ICU, they always get DVT prophylaxis. So this was another important lesson for us. Now, another drug that was used was baricitinib. It was used in the ACT-2 trial. It's one of the big trials. Now, at this time, when this trial was being done, remdesivir was, in vogue. It was used a lot. So they said baricitinib plus remdesivir and placebo versus plus remdesivir. So all patients are remdesivir, but what about if we add baricitinib? The time to recovery was 1 day shorter. The time to recovery among patients receiving oxygen was 8 days shorter. 10 days versus 18 days. And serious adverse events were just not that significant. In fact, they were lesser than the placebo group. So again, this is right now, recovery is doing a trial in India wherein they're covering comparing baricitinib versus no baricitinib. There's no question of remdesivir there. So baricitinib versus baricitinib, I think they've stopped the enrollment for this trial, which means the results will be expected quite soon. So let's look forward to that. Now, remdesivir. I mean, this was one drug which was more talked about on WhatsApp rather than on more other forums like ours. So look at the data. When it comes to mortality, no difference. Mechanical ventilation, no difference. Serious adverse events, no important difference. Viral clearance, high degree of uncertainty, very low evidence. When you look at acute kidney injury, delirium, no important difference. High uncertainty, no difference. Duration of hospitalization was not different. So the WHO solidarity trial results were actually like, this drug really doesn't work. It was a repurposed drug. It was actually never even made for COVID. It was a repurposed drug, used a lot, but now we have data to believe that this may not be that great as we were thinking it to be. And we've got better options. Now, another therapy that was used was tocilizumab. It's an IL-6 receptor inhibitor. So compare this to standard of care. The mortality is less. Mechanical ventilation use is less. Now we were, again, whenever you're using an immunomodulator or an immunosuppressant, you're worried whether it's going to cause bacterial infections, whether there'll be adverse events. Not that much. Duration of mechanical ventilation is lower. Duration of hospitalization is lower. Almost a difference of about 4.5 days. Low quality evidence, but still the evidence is supporting its use. So probably tocilizumab would be used a lot more. Now let's come to another thing that was talked about a lot. That was convalescent plasma. So I always, and I'm sure most of you also would have got calls from, do you know a person who's recovered from COVID? Can somebody give plasma? You have a plasma bank here. Wahan se plasma mil jayega. Kya karenge? There were many trials. Even the ICMR had done a trial which showed that it does not really work. There is, when it comes to mortality, mechanical ventilation, no difference. Any risks of giving it? Well, not really. Allergic reactions, no difference. But in the non-severe group, where people with, people who used to get COVID and they would start arranging plasma, it is not needed. It does not work. Now, what about severe patients? Here also, you see, severe means that these patients have a very high amount of inflammatory cytokines. In such a patient, giving them an antiviral or trying to neutralize the virus is probably too late. So if you go back to the initial slide that I talked about, we don't want to use convalescent plasma at such a late stage. So again, as expected, scientifically expected, it did not work. It was used a lot by many people, but there is no evidence for it. I don't think we recommend it anymore. So let's come to another case. Now this is where it gets severe. This patient's having shortness of breath, saturation has gone below 90 on blue air, the respiratory rate has gone up to 32, pulse rate is high, and the X-ray shows by the obesities. Now this is where it becomes a severe pneumonia. The respiratory rate of more than 30, SpO2 of less than 90 on room air. You can have ARDS, which has its own definition, and you can have sepsis and septic shock, which has its own definition. Such patients need an ICU. They have to be brought into an ICU. So here also we give anti-inflammatory drugs, we give anticoagulations, and we support their organ system functions. So we hope that with time these people will recover. And this was the surviving sepsis guidelines. I will skip through most of this. Now I really want to talk about something which is really exciting for us. We at Satyajam were in collaboration with the center, had a trial on Unani medicines as an add-on to standard of care. So we submitted the report, and so I won't talk too much about it, but I'll share our results. So this was an open-label, double-arm, randomized control intervention clinical study which was done in Satyajam Hospital. We had 43 patients who were on standard plus Unani medicine, and 47 were on standard treatment alone. And this was our results. So the clinical recovery was achieved in all patients in the Unani arm, in contrast to the control arm, where 3 patients deteriorated and had to be shifted to the ICU. In the intervention arm, there was a shorter duration of hospitalization, almost about 2 days difference. And the number of days taken for reduction of symptoms also showed a significant reduction. So, in the coming years, I believe, in the coming months, actually, why years? In the coming months, we believe that we still have a lot to learn. We still have a few more therapies which are coming up, more monoclonal antibodies and long-standing antibodies. We have vaccination which is coming into the picture. And there are multiple things, but one thing is for sure, we understand this disease a lot better than we did initially. We understand the phases of the disease. We understand where a drug would likely to act. We now know which some of the drugs which do not work, and we have a good idea of some of the drugs which are working. So I guess in the coming time, it's going to be an exciting time. And I would like to end this talk with a special thanks to Dr. Arjun Bhatnagar. He's my DM fellow, and he helped me put these slides together. So thank you, everyone.
Thank you, Dr. Rohit, for this enlightening talk. Indeed, it was a big challenge for the medical fraternity, and it still is, and we learned based on our experiences. It was a combined effort to combat this difficult situation. Both Ministry of Health and Ministry of Ayush played a proactive role. So thank you for sharing your practical experiences with us. You also briefed us on the study done in collaboration with CCRUM and Satyajam Hospital. So now we again see a panic in masses due to upcoming new variant Omicron. So what would you like to convey to our viewers from this platform?
We're still learning about this new variant. We're learning whether the vaccines will work or will not work. Whether all these monoclonal antibodies that we talked about, if the vaccine has changed its code so well, then probably we'll have to develop a new set of monoclonal antibodies. But what does work, is to have a good immunity, is to have good nutrition. We had an amazing session yesterday about nutrition. So these are things that are going to work against all viruses. To have your diabetes under control, to have your blood pressure under control, to have, those things are universal. Again, taking precautions are universal. So instead of, staying safe from COVID is more logical than getting COVID and then thinking what drugs are going to work. So I know this sounds like an odd advice, but it's the best advice that I can give with regards to Omicron, because data still has to come in for Omicron.
Yeah, indeed, we say prevention is better than cure, and we should try our best, following COVID appropriate behavior and taking care of our health and immunity boosting measures. So there is one more question which says, if there are symptoms of COVID-19, what would you advise in going for investigation at clinical level? What should be done and what should not be done?
The first thing is we need to assess what is the patient's. Well, first of all, we need to confirm the diagnosis. That's obvious. So we get an RT-PCR. The rapid antigen test was also used, but if it is negative, it does not rule out. So even if it is negative, we advise RT-PCR needs to be done. Then the second step is, if the patient has COVID, you need to assess whether I talked about the mild, moderate, and severe, and what stage of the disease is. If the patient is having viremia, we want the patient to have a strong immunity, fight the virus, and be done with it. If the patient has risk factors and has the may progress, then we want to monitor them very closely, and we have some antibodies to give to them. If the patient is not progressing, this is another thing. Many patients, got a CT scan done on the very first day we got the COVID positive report. Now, first day, the bacteria is just in your throat. It's not, the virus may not have caused lung damage. The lung damage occurs because of the cytokine storm, which occurs, say, after the 7th day onwards. Getting a CT done every 2 weeks is just not an option. Every 4 or 5 days is not an option. We just want, if you are not improving or your oxygen levels have gone down, then please go and get a CT scan done on the 5th day or the 7th day, but not on the 1st day at least. Again, blood tests are more to see how good your diabetes is controlled, look at how good your liver and kidney functions are. If there is any organs that requires support, we need to get to know about it. Many people got D-dimer done. Again, only for moderate patients we advise that it should be done because they will be requiring anticoagulants, but not all patients. So that's a small thing that I'd say. And then leave it for the doctor to decide what he wants to get done. So don't ask for a test on your own.
Just wanted to highlight over, because this was a new thing and people were listening more to, what nowadays they call WhatsApp University, and they used to follow those advices and over-the-counter use of certain medicine. What is your take on that? What would you like to convey to our participants over here and listen?
Yeah, honestly, everybody should have faith on their doctor. If you don't have it, then how can you trust your life on it? So if you have faith on your doctor, then you won't go by WhatsApp University. So don't over-investigate yourself. It doesn't help. What we advise is get investigations which will have a bearing on your management. So if the CT done on the first day, you come to me, I will tell you your saturation is okay, everything is okay. Why did you get a CT scan done? I will still give you the same drugs that I would have given you even without that CT. So every investigation should be, at the back of your mind. You have to think, agar is investigation mein ye aaya, this is going to be my treatment plan. But so again, patients cannot decide it. It is for the doctors to decide. So just have faith in your doctor.
Yes, and we heard you talking about, immunity and how to take care of our immunity, and immunity should be strong. And I must say that our Ayush system, including Unani system of medicine, lays more emphasis on improving the immunity. In fact, there's a concept of Kuwate Mudabbirai Badan that is called as Medicatrix Naturae. It's a natural healing power. We try to strengthen that healing power, and then there are certain, lifestyle modifications and advices based on 6 essential requisites, principles in Unani system of medicine. So I would say yesterday also it was highlighted by our speaker, and now also we'll be hearing the Unani perspective also, experience sharing, and we have lined up and we yesterday discussed in detail what all should be taken in nutrition to take care of your immunity, as well as there are lifestyle modifications. So thank you for joining us. Now we'll move to our second speaker. Now I'll invite Dr. Iftikhar Hussain Ghazi, Medical Superintendent, Kashmir Tibia College Hospital and Research Center. Dr. Ghazi was born in Srinagar, Kashmir. He qualified BMS from Dr. Abdul Haq Unani Medical College, Kurnool, Andhra Pradesh, and Dr. Ghazi retired as District Ayush Officer in Jammu and Kashmir. He worked as Divisional Nodal Officer for COVID-19 for Kashmir Division, and also worked as Coordinator Liaison Officer, Government Unani Medical College, Gandarbal, Kashmir. He also received awards from top state government officers. He actively participated in COVID-19 awareness in public. Presently, he is working as Medical Superintendent, Kashmir Tibia College Hospital and Research Center, Jammu and Kashmir. Thank you for joining us.
Yeah.
Because Dr. Ghazi is traveling, he'll be doing the talking from his phone, so we will not be able to see him. His camera is not working, but I welcome him, sir. Please.
Thank you. Thank you, Dr. Ghazala. Honorable Professor Asim Ali Khan Sahib, Director General CCRUM and Advisor Unani Ministry of Ayush, Government of India. Professor Abdul Wadood, Director National Institute of Unani Medicine, Bengaluru. Dr. Rohit Kumar, Department of Pulmonary Critical Care and Sleep Medicine, Vardhaman Mahavir Medical College and Safdarjung Hospital. Dr. Ghazala, Good afternoon to all and other participants. I regret firstly because I'm right now in Noida. I don't have a logistics with me like laptop so that I can make a good presentation which we have worked in the Jammu and Kashmir during the pandemic. But I would like to share my experiences, and I would like to share the work, the way our medical officers, our staff, paramedical staff worked during the pandemic in Jammu and Kashmir. So, the firstly, it was the March 25 when we came to know that the first patient in a Srinagar in downtown area Khanjar turned positive. It was a huge chaos that time in the Srinagar when we came to know about this the patient. And after a few days, we got a call from our worthy director, Dr. Mohan Singh ji, and I was nominated for Kashmir division as a divisional nodal officer for COVID-19. We have established a control room in Srinagar at the headquarters. The control room was comprising of all the allopathic control room, and simultaneously we have established our Ayush control room side by which where I was having two senior PG doctors to guide how to combat over this COVID-19. And at the same time, I directed all the district Ayush officers throughout the Kashmir province in all the 10 districts to make one control room.
Want the slides to move on?
Yeah. It's okay.
Okay,
Yeah.
you can let us know by saying next or next slide so that staff will move it. Thank you.
Sure. So, in the wake of COVID-19 pandemic, as we know, the whole globe was suffering from this COVID-19. There was a huge chaos that time, and our Union Territory of Jammu and Kashmir was no exception. From the day this pandemic set its foot in our state, so at that time, Directorate of Indian Systems of Medicine remained proactive in taking all measures for the containment of this pandemic. Next slide, please. At that time, as I said earlier, we had set up our control room in the old secretariat of Srinagar, where from we were operating throughout the Kashmir province, and we have to collaborate with the allopathic department of Kashmir division, by which we have provided all the staff, all the medical officers, paramedics. We have worked jointly in like if you can show the another slide in our so our medical officers, paramedics who were working in this COVID-19 in containment zones, in testing, in different areas of the like I should say here Gurez to Zig of the tunnel, which is the far-flung areas. There where our medical officers, our paramedics were working jointly with the allopathic department. After that time, when the COVID-19 was on its peak, we started our telemedicine in every district, by which our expert medical officers were giving advices to the patients on the telephone regarding the medicines. And at the same time, we got the advisory from the Ministry of Ayush, Government of India, through our directorate, that they have nominated some medicines which are immune booster, immune modulators. We have to distribute among the people, those who are suffering from the COVID-19 or those who need these medicines in order to boost the immunity. And we started distributing our all immune booster medicines in the government departments like district administrations, divisional administrations, police personals, first frontline workers, for which we have distributed in lakhs medicines in the 2020 and 21. And we have found a very good response. I remember well, it was 9:30 p.m. in the evening. I got a phone call from one of the senior IAS officer from the Kashmir, who is right now there, that he needs some medicine for his whole office at the division level. This divisional commissioner office. I arranged a medicine. Medicine has been already distributed to district levels through our directorate in a huge quantity. Then we started slight camps we have organized in these offices with all SOPs we were following, and we were distributing these medicines. Our expert medical officers were distributing these medicines among the employees of the various departments, whether it was the police, whether it was the CRPF, whether it was the education department, whether it was the district administration or a divisional administration. And it is a really a good experience which I have seen, and that the people were giving a good response. We were receiving a number of phone calls regarding the medicines which we are distributing, like ashwagandha, like guruchi, like I-64, like homeopathic medicines which we have distributed to the public. And at the same time, we got then instructions from our worthy director, Dr. Mohan Singh ji. We started distributing medicines to those patients who were isolated, who were home isolated, or who were admitted in the hospitals with a mild to moderate symptoms. And at the same time, Divisional Commissioner Kashmir, Mr. P.K. Pole, sir, he's a senior OS officer. They started conducting their meetings every Tuesday of the week. And I was getting a call from that office. We joined there. They already were knowing about these immune booster medicines, and they asked me to explain, to elaborate how to improve the immune system, which is the only source was that time which to fight the pandemic, because at that time there was no such a medicine, no vaccine was developed at that time. And with the same time was passing on, and we were distributing our these medicines to the public, common public, to the ailing public, to the patients, and to the frontline workers. This we continued for 2021, and I remember well when we crossed 3 to 4 lakhs. I was there in the office when I got the message 3 to 4 lakhs. We have already beneficiaries. We have given the medicine, these which I named earlier, and with a good response from the government as well. And after some time, when COVID started declining, we called our staff back to our institutions. Then from each institution, each ICE institutions from the every district, almost of the all 10 districts, they started from their institutions awareness programs regarding COVID-19 and regarding the medicines which we were distributing during the pandemic, those which are this immune modulators, immune boosters. And I will also share this experience that I got a phone call from top IPS officers. I visited personally to their offices where the huge police number. I might have sent the pics of that also if you can show that. Yeah. So we distributed these medicines there also, and it was a very good experience when I got again phone call from one senior IPS officer that he has a symptoms like COVID-19. I don't remember whether he was a positive or not, but on the 4th day when he was taking ashwagandha and other medicines of which we have given to him, he has recovered and he has shared his experience on phone to me. Even I would like to share this thing also. He called me to his camp, to his office. He awarded a certificate to me and my staff, which were busy in distributing the medicines. So same was the case with one of the senior officer. He was also a positive, and I got a phone call very late in the evening, and I was supposed to took my car. I rushed to his residence with the medicines like ashwagandha, I-64, and some other medicines. So I provided these medicines to him. His whole family was positive that time. Uh, I explained him how to take the medicines, and he was asking me there that I want ashwagandha and I want guruchi, I want shamshan bati. He told himself there, and these medicines were with me. I provided the medicines. After 1 week, he told me that I was, I was not able to walk. I was not able to talk. I was in a state of a depression when I got the symptoms like cough, upper respiratory tract infection, and a mild fever. But he has not taken any medicine during this because he has a mild symptoms. But he has taken the medicines which I already named earlier, and he called me himself on a phone after a week's time that I have recovered. I am with a good energy. I have started going my office with all SOPs. So these experiences which we have seen, and I met then one of the divisional administrator. I told them I have a project in this way that if a mild to moderate patients in a tertiary care hospital or super specialty hospital will be kept under the observation of Ayush experts, uh, so that they will be provided the Ayush medicines and they will be under the observation of absolutely under our doctors. In case any emergency, in case any complication, the tertiary care hospital experts are as well there, but that could not get matured because of some circumstances. But in future, maybe we may have to live with this COVID for more time till the things, till the vaccine medicines come in the market. My suggestions will be here that in a Jammu and Kashmir state also we will be provided such a opportunity so that we can keep a mild to moderate patients in the hospitals under the observation of the eye doctors. And at the same time, in the same 2020, then there was a meeting from the government level, top level. I was in a meeting that time, and they have nominated then Ayush doctors as well who have worked day and night, 24 hours around the clock in this COVID pandemic by giving awareness, by distributing medicines, by going to containment zone, by doing other things which were related to COVID-19 pandemic, and they were awarded. I was also awarded at the government level 3 times in during this pandemic, and we all our staff, our all doctors of the Kashmir division of the all 10 districts with paramedics have worked very hard during this pandemic, and we will continue to work. And we have already gained the experience with our counterpart allopathic doctors, how to handle the serious patients, how to handle the patients who are having the complication, or the patients who are with the comorbid. Uh, we have gained such experience, and they have also shared the experience. I would like to share here once again, Chief Medical Officer, one lady in Srinagar, her mother was having a symptoms like upper respiratory tract infections and a cough. And she asked me to give me your own medicines, your Ayush medicine, your Unani medicines. And I have provided her the medicines. After 10 or 11 days, she called me and she asked me again to give some medicines because she is recovering and she is fine this time. And this was a very happy. I was very happy to listen what she told me. Such experiences we have seen during this all pandemic, and we would like to continue with this all. And uh, I would like to thank you because I could not make a detailed presentation because I'm out of state right now, not having laptop and other things with me. And I thank you all. Jai Hind.
Thank you, Dr. Ghazi, for letting us know the noteworthy work done by by you and your team at Jammu and Kashmir. Your outreach activities to masses is praiseworthy, and it's a fact that Ayush doctors were involved in multifaceted activities, whether it was contact tracing or distribution of prophylactic medicines, awareness generation, teleconsultation, or any other, and involvement in research studies, collaborative projects, IC activities. So Ayush doctors played an important role, I must say. And I'll come back to you. I have a question for Dr. Rohit. It says, will you give any special advice for school-going children?
Yeah. Okay. So personally, I'm in adult medicine, so I don't really deal with pediatric cases. But I think whatever we know about adults can be extrapolated to children. So my first advice, at the risk of sounding repetitive, I would still say avoid getting COVID, first thing, obvious, and good nutrition, good health, and a strong immunity. That's not for COVID. That's for all viruses, for all infections.
Actually, it's also for vulnerability. How vulnerable are school-going children for COVID-19 and for this new variant also?
Yeah. So let's go by the data on this. Initially we did not have that many pediatric cases, but in children we've seen some very typical manifestations about how they used to have something, cardiac muscle involvement. There is a syndrome which is a lot like Kawasaki disease that they have it. So they are vulnerable. Do not think that children cannot get it. They can. They can have a very severe disease that too. But I think the elderly, the children of every population are always the at-risk population. So that goes without saying.
And as of now, will 2 doses of vaccination are enough to save us from the current variant?
So this is again a point of contention. So there is we do not know what the vaccination the entire group is going to come up with, but I would like to believe that yes, a booster will be required if the virus mutates. Now, in influenza, we have a vaccine which comes every year. There's an annual influenza vaccine. So it's possible, I'm speculating here, that if the virus keeps on mutating, and it's an RNA virus. So RNA replication is error prone. So these viruses do tend to replicate, do have mutations. So if there are multiple mutations, probably a new vaccine would be required. Coming to evidence, there are trials which have been done in a few countries wherein even a third dose was given, and that is not reimmunization, but that is a booster. So let's put it. So booster is something different from having a new vaccine for a new virus, right? So if there's a totally new virus which is there, so that requires a totally new vaccine. So booster, vaccine, revaccination, we're still learning the ropes on this one.
And we have to follow the guidelines, issued from time to time by the government after having consultation with the experts of our, country and medical fraternity. That we have to follow. And there's one more question. What is the multi-system inflammatory syndrome associated with COVID-19?
This is what I was talking about. Children have what is known as multi-inflammatory systemic syndrome, and the name suggests it. There is so much inflammation that it starts affecting multiple systems. And there's a diagnostic criteria which has been come up by the CDC, WHO, and they just tell us that children did not always have respiratory involvement. In fact, when we started this, my training thankfully was in medicine. So this is not a respiratory disease to begin with. It is a multi-system disease. It affects the heart, it affects the kidneys, it affects the pancreas, and that is why all specialties had to come in and put in their inputs in managing COVID. So multi-system is something that we see in children. In adults also it has been reported. Multiple case reports, quite a few case series on this. Treated with steroids, even IVIG, intravenous immunoglobulin, is used to treat it. So didn't really touch this because I was not really focusing on the pediatric age group, but yes, in multi-system inflammatory disease is another manifestation of COVID that we come across.
Coming back to the collaborative trial you told us about between CCRUM and Satyajang, and there's a published paper also. What would you suggest, in near future we should enter into more such collaborations, and at what stage we should be there, no, when we are entering into the collaboration? What is the right time? And how
This
we
is
should?
really an exciting project that we got to do with in collaboration with the CCRUM. And we have in Saptajan, we have Unani OPD, which is running. So we had the team from there. They helped us out. They got the medicines, and it was done by scientific principles. It's not like, I want to give a medicine. I tried it. I saw it, gave it to 10 patients, and they got better. We gave it to some patients. We did not give it to some patients, and we surprisingly, despite the fact that we did not get all the patients enrolled, in the analysis itself, we found that 3 patients who did not get it actually ended up going into the ICU. Again, this is a very small sample. I'm not saying that this is, we are 100% sure, but yes, it works. And logically, if you have a strong immunity and you neutralize the virus, early phase, it was definitely going to work. So, I would love to have more collaborations on this and see how this thing pans out, a larger population.
Yes, you're right, and it's been a river at CCRU also under the guidance of our DG sir. He ensures that we should follow all the scientific guidelines and protocols and maintain the standards. That is the river at CCRUM. Coming to Dr. Ghazi. Dr. Ghazi, you gave a very nice presentation and showed us, many pictures and acceptability in the masses. What would you like to convey, because you distributed almost all IU systems, including Unani, and in that perspective, how to take care of our health now, when we are facing the challenge of new variants. What is your take? What would you like to say to our viewers from this platform?
Dr. Guzar, I would like to tell you this was just a 1% of my presentation. As I already told you, I am out of station. I don't have details and all other logistics with me. But I remember well, I had gone on TV on the Jammu Kashmir channel, that is Doordarshan Kashmiri. One show was live that day, and we used to get a phone calls on that show. And I have given at least 15 programs on the TV and the radio and FM in order to aware the public to follow the SOPs, advisories issued time to time by the government and the health ministry and Ayush ministry. And right now, as we are facing again this Omicron, which has been witnessed in India as well, we have to take care. We have to go for the vaccination. We have to build the immune system by taking our immune modulators. And at the same time, I would like to say that we have to opt a healthy lifestyle, because unhealthy lifestyle has given born to a number of such diseases, which has those patients have become a comorbid, and where the first patients witnessed in throughout globe were turned positive. So for that purpose, we need to concentrate. We need to look our healthy lifestyle so that we can maintain our immune system. Because it was earlier seen in the pandemic, number of patients, but I should say more than 80% patients was always coming in the Nevis channels are asymptomatic. That is why, because their immune system was very strong. We have to maintain this immune system, not by staying in the home. We have to do the light exercises. We have to follow the SOPs. We have to take the good diet, healthy diet, balanced diet, like more vegetables, vitamins, and at the same time, vaccination as well. And we have to advise our neighbors. We have to advise our friends, our colleagues. We have to advise our patients how to take care of this COVID-19, because we are the best source to aware the public, to aware our areas, to aware our neighbors, how to get rid of this COVID-19. And I hope the allopathic people are working very hard, and our Ayush ministry and Ayush doctors are working very hard. We will definitely come over it, and we will win this war very soon. Thank you very much.
Yeah, you are right. We are working together, and we are in this together. And Ministry of Ayush has, taken many measures when we are talking about, protecting our health and boosting our immunity. There is Ayush for Immunity campaign, and there is, talk about Giza and Ahar, how to take, good nutrition and diet to take care of your health. Easy recipes are shared. So yes, we are working towards it, and we'll be able to lead this challenge. Thank you. Now I'll invite the moderator of this session, Professor Abdul Wadud Sahab, who's Director, NIUM Bengaluru, for his concluding remarks. Sir, you may also highlight in brief the work done by NIUM, your institute. We have also received a question in this regard. And I welcome Mardi.
Thank you. Am I audible?
Yes, sir.
Yeah. Thank you. Assalamu alaikum. A very good morning to all of you. Respected Professor Asim Ali Khan Sahab, DGCCRUM, Dr. Rohit, an expert from pulmonary care medicine, and Dr. Iftikhar Hussain. So I am very much thankful to CCRUM to give me this opportunity. CCRUM has always worked for the cause of Unani system of medicine, and National Institute of Unani Medicine is also working on the same lines. So CCRUM, with under the guideship of Ministry of Ayush, Government of India, and side by side Ministry of Health and Family Welfare, Government of India, who played a very vital role during 2 waves of this COVID-19. In continuation to their various programs, CCRUM has organized this for I think 5 days webinar. Today is the 3rd day of the webinar, and CCRM has chosen a very good topic for the seminar, that is lessons and experience learned through this COVID-19. It is a need of the time. It was that no completely, but almost we have came out of this worst situation, but still we have to do very much. That is what the lesson we have learned from these 2 waves. That can be achieved by knowing certain facts about the experiences that was shared by those people who were actively engaged in management of COVID-19 disease. That's today 2 learned speakers presented their view. One of them is Dr. Rohit Kumar, who is a specialist in pulmonary care medicine, and he shared his experience through a case report. I think that was a case report. He shared his experience through a case report, and he also highlighted the pathology through its different stages. He highlighted the patients who are most at risk for COVID-19. The patients who were treated as per COVID-19 guidelines of management. He also shared his experience. He also evidenced his presentation by showing some publications that were published on the efficacy of various modern drugs used in COVID-19. He also emphasized on early intervention to prevent the worsening of the COVID-19. He highlighted the use of various managements and drugs which are used in management of COVID-19. For example, he highlighted the importance of oxygen therapy, oxygen support, use of anti-inflammatory drugs, use of immunomodulatory drugs, use of antiviral drugs. So he focused most part of his presentation on management of COVID-19 at different stages of the disease. I think if we keep aside the use of modern drugs, we can learn much more from this presentation. So how to Unani fraternity, Unani people can also involved in the management of COVID-19 disease. Thanks, Dr. Rohit. Another speaker was Iftikhar Hussain from Jammu and Kashmir. His topic was Ayush intervention in management of COVID-19. He shared his experience with the various pictures that were taken during the management of COVID-19. His focus was mostly on an integrated approach. He showed as shown by his pictures. He showed control rooms, pictures of control rooms that were organized during the COVID-19, and he worked jointly with the modern side. They all worked. Help of people. They also helped people through telemedicine, through advice over telephone, and distribution of immunomodulatory drugs at mass level. He also mentioned the names of scientifically proven drugs which are from Unani medicine and as well as from other Ayush medicines. The main lesson from this presentation, what can I learn, and people should also learn, Unani fraternity should also learn, that we should work jointly in a integrated approach, in a coordinated approach to tackle any situation, how worse it is. Friends, these two speakers, though not very closely related, their presentation are not so very closely related, but I think both are useful for us, and we should learn much lessons from these two presentations. Friends, COVID-19 is a natural disaster. The healthcare concept was totally changed. Decades ago, medical science was concerned and focused mainly on the control of infectious diseases, and to a great extent they achieved success, and the focus was shifted towards management of NCD. But once again they have switched over to the control of infectious disease. Once again, COVID-19 is one of the example. It also made this what lessons we have learned from this COVID-19 waves. It makes us to conscious about the personal health, personal care, and precaution of social distancing and sanitation that was always a solution for healthcare givers. The other lessons that we all got was about our body defense. Unani medicine has emphasized the concept of tabiyat, though vaccine is an specific for immunity against COVID-19. But Unani medicine has always talked about a general immunity, that is a tabiyat mudabbara badan, and that gives immunity to many diseases. In COVID-19 days, we saw that there was wide and immense reaction towards COVID-19, that we depended upon individual constitution and a style of life. Presently, it was related to immunity through Unani defense mechanisms that are very much more than immunity alone. The holistic approach of Unani medicine gives us understanding of food and drugs that have played a very great role in framing rational and evidence-based guidelines through Unani medicine. Lastly, the important lesson that we have learned is to be alert about to respond optimally to such worst situations. Biological adversities are always thought to come. The experience we got are enough to make to and withstand to these situations and avoid the panic in future. Now it is time to focus on other mechanisms at community level rather than to focus on individual level. So I'm once again very much thankful to the organizers that give me this chance. Thank you. Jai Hind.
Thank you, sir. And you talk about the integrative approach, and I would say that the under the guidance of our Director General CCRUM, Professor Asim Ali Khan, the integrative aspects in various activities of CCRUM can be highlighted at odd level of its multifaceted activities like clinical practice, research, education, and public health program. And the council has identified certain priority areas for integrative research studies, and final outcome of the projects is published in the form of the research papers in the journals international and national repute, and results are also disseminated through presentation in the various international and national seminars and conferences. So thank you very much for being there. Now to propose vote of thanks, I invite my colleague Dr. Pawan Kumar Yadav ji, who is a senior research officer clinical pathology and is involved in important work related to patents, collaborative research, along with other important core values. He is a dedicated officer of council doing all the running around. Over to you, Dr. Pawan.
Thank you, Dr. Ghazala. Am I audible?
Yes.
Thank you, Dr. Ghazala. Thank you for providing me an opportunity to propose the vote of thanks in today's webinar on COVID management, and the COVID-19 management and experience sharing. I am really grateful to and thankful, especially thankful to Professor Asim Ali Khan, DG CCRM and advisor Unani, Ministry of Ayush, Government of India, for delivering his welcome address and his guidance in organizing the webinar series. I also extend my esteemed thanks to esteemed speakers, Dr. Rohit, Assistant Professor in Department of Pulmonary Care and Sleep Medicine, Vardhan Mahavir Medical College and Sub-Region Hospital, New Delhi, and Dr. Iftikhar Hussain Ghazi, ex-medical officer, Government of J&K. I also thank Professor Abdul Badood, Director, National Institute of Unani Medicine, Bangalore. I would like to mention and convey my sincere thanks to the organizing team, especially Dr. Ghazala, who is the research officer, scientist level 3, and her team for coordinating this program so well, along with his IT team, especially social media team, and all other associated staff who helped in organizing this webinar. I must mention here that Dr. Ghazala and I work together like a team and have organized many events under the guidance of our DG, Professor Asim Ali Khan Sahab. We together look forward to host more such events as per mandate, both in physical and virtual mode. Thank you so much.
Thank you. Thank you. And I'm sure under the leadership of our DG sir, we'll be organizing more such events in future, both in physical and virtual mode. And before we wind up, I would like to inform our participants that we'll be there on 20th December, Monday, same time, 2:30 to 4:30, and we'll be having a webinar on taking care of mental health during and after COVID-19, which is also a very important topic. So I request you all to be there, and also fill the feedback form. Once you close the window, the feedback form will come to the participants. Kindly fill that form with us. Your suggestions are valuable to us. Thank you one and all.
Thank you.
Thank you. Thank you very much. Thank
Thank
you,
you.
Dr.
Thank you.
Rohit. Thank you so much for being here. Dr. Ghazi, Dr. Rohit Sahib, thank you so much.
Thank you, sir.
All
Thank
the
you very much.
participants. Pleasure having you all together. Thank you.
Thank you, sir.
Thank you, Dr. Ghazi sir. Thank you so much.